If you're a researcher in international development, it's likely at some level your findings will be relevant to policy. You might even want to affect policy as part of your research. But how can you do this? And what are the most effective ways to influence policy? Hello, and welcome to Laser Pulse's module on Making an Impact, Pathways to Policy Change for Researchers. My name is Michael Scanlon, and I am the Assistant Director of Research for the Indiana University Center for Global Health and for the academic model providing access to healthcare partnership in Kenya. We hope this module helps you think about strategies that you can use in your own research to increase the likelihood that your research and findings will be used to impact policy. Additional resources are provided at the end of this presentation, as well as in a supplementary guide titled Impacting Policy Change that is available as part of this module. There are three primary objectives of this module. The first objective is to describe what has been referred to as the research to policy gap, including what this gap is and why it exists. The second objective is to learn about the laser pulse model for embedded research translation and how it can be used to increase the likelihood that your research will make an impact on policy. And finally, the third objective is to identify strategies that researchers can use to increase the likelihood that their research will impact policy. These strategies that we will discuss were informed by the laser pulse model for embedded research translation, as well as a review of the academic and gray literature, with key sources and references provided at the end of the slide deck. So let's jump in. You may have heard this phrase before, the research to policy gap. So what is it? Well, there is no single definition, but it is often used to describe the fact that evidence produced by researchers often doesn't make it to informing policy. This may be true because 1, it does not make it to the desk of policymakers, 2, it is not used by policymakers to inform policies, or 3, the period between the production of evidence and policy impact is too long. There are many different explanations for why this gap exists between research and policy, but the most common explanations generally fall into two camps. The first explanation, often provided for why there is such a big gap between research and policy, is that researchers and policymakers are just different. They have different training, they have different pressures and incentives that motivate their actions, and they often even speak different languages. While these assumptions about researchers and policymakers may be true, they also are oversimplified views and ignore potential areas of shared interests and collaboration. For instance, many researchers really do want to make an impact and are increasingly asked by grant sponsors and their academic institutions to demonstrate that their research has in fact led to broader changes in practice and policy, particularly for researchers engaged in studying development issues. In addition, policymakers themselves often face pressures from voters and other interest groups that the policies they support and create are informed by the best available evidence. The second category of explanations for why the research to policy gap exists is that many people, including many researchers, often have an oversimplified view of the policymaking process. We often think of the policymaking process as being a linear one, where we start with a problem or challenge that could be solved with a new policy or maybe a change to an existing policy. In this simplified model, researchers can play the role of producing evidence for a policy intervention or solution, and then policymakers take that evidence and use it to inform the creation of an evidence-based policy. Researchers may also play a valuable role in evaluating the implementation and impact of a policy to see if it is having its intended effects, and if necessary, policymakers can then use this additional evidence to revise or adapt the policy intervention accordingly. But of course, we all know that the policy process is much more complicated than that. In reality, the policymaking process might look something more like this. In most cases, Policymaking is an inherently complex, non-linear process. This process involves many different types of policy stakeholders. Of course, it is not just politicians and lawmakers that influence the design, implementation, and evaluation of policy, but also bureaucrats, lobbying and interest groups, implementing organizations, voters, media, and researchers. All of these actors can influence policy. The policy process is also impacted by things like broader social, economic, and political conditions, such as economic crises and election cycles, budget constraints, and competing political and policy priorities. The opportunity for a policy issue to actually get addressed through a formal policy often requires a convergence of these different factors and means a specific policy idea may have only a narrow window to emerge into actual policy. Researchers and the evidence that researchers produce play one part in this puzzle of policymaking, but our understanding of both research and policy has led to new ways of thinking about how we can better design, implement, and translate research so it has a better chance of impacting policy. Laser Pulse seeks to generate evidence-based solutions for development challenges that are translated into practice and policy. To impact policy, researchers can work together with a variety of actors, including policymakers themselves, to influence specific policies. By working collaboratively with partners and key stakeholders throughout the entire research process, researchers can ensure that their findings are relevant to policy, are accessible to policymakers, and are packaged appropriately for usage and ultimate impact. This approach is defined by Laser Pulse as embedded research translation, an iterative, co-designed process that occurs among academics, practitioners, and other stakeholders, in which research is intentionally applied to a development challenge. On the right side of the slide, you can see Laser Pulse's approach to embedded research translation visually. As the graphic illustrates, research translation is embedded throughout the research process. Researchers and various development actors engage in close collaboration at the onset of the research project through the dissemination of the translated product, and together seek ways for the research to have wider application and impact. Results of this collaboration, detailed in the upper left side of the diagram, include discovery, learning, innovation, and a field-tested solution. Importantly, this is a non-linear process that incorporates potential failures and adaptation over multiple iterations, with the understanding that eventually the team develops a field-tested solution that can be translated into practice and policy. Once the team has established a field-tested solution, they can then engage other, sometimes new partners in dissemination. These steps, shown in the right side of the figure, include increased awareness, replication and scale of the solution, wider application, and eventually large-scale impact. Here you can see the 4 pillars of embedded research translation: partnership, collaborative process, product, and dissemination. Thinking about these pillars in the context of impact on policy, researchers should think about identifying and partnering with relevant policy stakeholders, whether they are policy makers or other individuals or groups who influence policy, and establishing a collaborative process about how to work with these policy stakeholders throughout the research process, from formulating the research question and design, through conducting and interpreting the results, to dissemination. Researchers should also consider co-designing multiple translational products from their research that can inform policy and policy stakeholders, things like policy briefs, white papers, and data visualizations. And finally, researchers should plan for dissemination and scale-up beyond their research product so that their findings can continue to inform and contribute to evidence-based policies and policymaking. Based on Laser Pulse's approach to embedded research translation and a review of the literature, we present several strategies that researchers can use to increase the chances that their research will have policy impact. We have grouped these strategies into 4 buckets, which we define as plan, do, push, and learn. We will review each of these strategies and then review a case study from the literature that successfully used many of these strategies in work to influence health policy in Kenya. The first set of strategies are related to the planning stage of your research and involve identifying the relevant policy stakeholders and policy environment in which your research sits. Remember, policy stakeholders refer to the broader group of individuals and organizations who influence one or more steps of the policy process, and include elected officials and their teams who are directly charged with policy making, but also actors like bureaucrats who are often charged with implementing policies, think tanks and non-governmental organizations who may be conducting their own research on policy, and groups like media organizations and other interest groups who influence the policy process. The size and range of policy stakeholders who are relevant to your research will depend on your area of research and the policy environment. Health policy scholars Walt and Gilson identified 4 key components of the policy environment, something they referred to as a health policy triangle, that are important for researchers to understand when thinking about how their research can impact policy. When we refer to the policy environment, we are not only thinking about the actors who influence policy, but also the content, processes, and context. By content, we are referring to the specifics of a policy. What does the policy include, and what is it trying to achieve? By process, we are referring to the laws and rules that dictate how a policy is formulated, how it is formalized, and how it is implemented. As you likely know, there can be a difference in terms of what a policy says on paper and how it is actually implemented in real-world settings. And finally, by context, we are referring to the larger political, social, and economic climate that impacts the policy process at all stages, as well as how it impacts researchers and how they engage in the process. There are several planning strategies that researchers can use to better understand the policy environment relevant to their own research. These include conducting literature reviews and internet and media searches, stakeholder mapping, and informal interviews with key policy actors and stakeholders. On the right, you can see an image of the Laser Pulse's stakeholder analysis tool that you can use to help you identify policy stakeholders, their interest and level of involvement in different stages of the policy process, and how to use that information to best engage them in your research. As a reminder, all of Laser Pulse's resources are available for free to Laser Pulse Network members at laserpulse.org/learning. The set of do strategies are related to designing and conducting research that is relevant and inclusive. By relevant, we mean that research is responsive to a specific policy environment and a policy need, whether that's at the stage of formulating a new policy, implementing an existing policy, or evaluating an existing policy. By inclusive, we mean that whenever possible, you as a researcher are engaging and involving other stakeholders as partners in the research process. The level and form of engagement of policy stakeholders in your own research should be thought of as a spectrum rather than as something you either do or don't do. On one end of the spectrum, you may only engage policy stakeholders as consumers of your research, for example, by sharing policy briefs based on your research findings. At the other end of the spectrum, policy stakeholders could be deeply engaged in the research process as full research partners, including participating in aspects of the research design, implementation, and interpretation of findings. At this level of deep engagement, research can be thought of as co-produced by both researchers and their research partners. There are several benefits, but also challenges to co-producing research with partners like policy stakeholders. The most significant benefit is that research that is co-produced with policy stakeholders as full partners is more likely to, 1, be relevant and responsive to a policy need, and thus, 2, to be used to inform or impact policy. Deeply engaging partners in the co-production of research, however, also requires an increased investment in time and other resources, as well as the challenges associated with working with a diverse group of research partners who may not have similar backgrounds as researchers. And finally, depending on the policy environment, there may also be challenges associated with the perception of bias if researchers are partnering with certain policy actors, including bias in how the research is designed, as well as how the findings are interpreted. It is important for researchers to carefully plan for working with policy stakeholders in the research process, including clearly identifying partner roles and expectations and shared work plans throughout the design, implementation, and dissemination phases of research. And finally, when you are designing and conducting your research for maximum policy impact, it is important to be clear about your impact objective. In other words, a statement of what kind or kinds of policy impact you are aiming to achieve with your research, and how you will strategically work to make this happen through all stages of your research, including identifying research partners and collaborators, the design and approach of the research project, and how you will disseminate information about your research, which we discuss in more detail on the next slide. Remember, when thinking about your policy impact objective, there are many different ways that research can impact policy. Here are just a few examples, including research that helps inform a new policy, small or incremental changes to existing policies, influencing who is at the table for policy discussions and the range of policy options considered, and policy impact at different scales, whether it be local, national, regional, or global. The third set of strategies are related to push strategies to disseminate and communicate effectively about your research and findings. You should plan for multiple dissemination and communication strategies that occur at various stages of the research project, not only after the research is completed. And you should also consider multiple translational products. Translational products can take many different forms, but should be tailored to your specific audience based on what you want them to take away from the research and how best they receive information. A few examples of translational products that are particularly relevant for policy impact are provided in the table on the right. When thinking about your dissemination and communication strategies, remember, researchers are not just knowledge producers. To be effective policy change agents, researchers also need to be knowledge translators who can translate research findings to non-specialist audiences, and to be knowledge brokers who can work alongside policy stakeholders and policymakers to incorporate research findings into policy debates and instruments. In your communications with policy stakeholders, remember to use non-technical language, have clear and concise key messages that relay research findings and their potential implications for policy, and be engaging. Remember, every time you are communicating with policy stakeholders or anyone else, you are telling a story about your research. Check out Laser Pulse's module on storytelling for strategies and techniques about how to better communicate about your research. There are a number of other Laser Pulse resources that have been created and can be used to improve your dissemination and communication strategies, and a few of these are listed here. I encourage you to take a look at these resources as you think about how to plan, do, and push your research for maximum policy impact. The final set of strategies are related to learning and include monitoring, evaluating, reflecting, adapting, and sustaining. Monitoring and evaluation plans that are co-created with research partners are great tools that researchers can use to measure progress towards their policy impact objective. There are many wonderful frameworks out there, so you should pick one that works best for you and your research partners. There are several frameworks that were developed specifically for research that aims to impact policy. An example of this type of framework is one by Hovland, published in 2007, with the full reference available on the reference slides at the end of this slide deck. In addition to monitoring and evaluation, it is important for researchers to build in time and settings for reflection on how their research project is going. This is especially important for research projects that involve a number of different research partners, including policy stakeholders, and for the group to be able to come together at various stages of the research, from design to implementation to interpretation and dissemination, and to openly discuss the achievements and challenges of the project. It is also important for researchers and partners to be willing to adapt, including adapting the approaches and strategies that the team is using to impact policy. The need for adaptation can occur from conditions internal to the research project, as well as external factors related to the policy environment. This process of monitoring, evaluating, reflecting, and adapting constitutes the process of learning, and it is an essential process for researchers and their partners to increase the likelihood that their research will have an impact on policy. And finally, make a sustainability plan with your research partners to ensure that your research continues to have an impact on policy even after the project is over. While researchers may move on to new projects, it is important to identify actions that researchers and their partners and project champions can take to continue to engage in policy dialogues about your research findings. The final part of this presentation introduces a case study from the literature and illustrates many of the strategies that we've outlined in this module. This case study comes from a research team that is part of the Resilient and Responsive Health System Consortium that supports research to improve health policy and governance in low and middle income countries. This team has created what they call learning sites in South Africa and Kenya, which comprise teams of researchers and policy stakeholders to co-create and conduct research on issues to address key health policy and governance issues, mostly at the local, county, or provincial level. On the right, you can see a figure that illustrates their collaborative processes of research design and dissemination with local policy stakeholders. I won't go through all of these, but to highlight a few, the model includes building trusting relationships between researchers and partners, including policy stakeholders, engaging in national health policy dialogues, developing teaching materials and programs for health managers as an example of a translational research product, and widely disseminating their research at different scales, from the local level to the national to the global level with partners and communities. This example comes from the consortium's Kenya Learning Site. In conversations with their research partners, who were mostly local county-level health managers who were responsible for implementing health programs and policies for the county health system, the research team identified the following problem. Due to a change in national health policy, local hospitals were no longer able to access revenue generated from fees charged to patients for certain services. The research team, comprised of researchers and county health managers, conducted a research project to better understand the impact of this policy change on local hospital revenues and how it affected services and procurement of supplies. The research team also worked with local stakeholders to identify policy solutions to bring to the local county health policymakers, which were facilitated by the inclusion of health managers on the research team, who worked closely with these policymakers. The result of this research project was that the research team was not only able to demonstrate a negative impact of the current policy, but also to propose policy alternatives to county policymakers, which ended up informing a new local county policy, the Khalifi Health Sector Facility Improvement Act, that provided a policy solution for hospitals to access additional funds. Moreover, other counties in Kenya are currently exploring similar policies, while the research team has been engaged in national health policy committees to further disseminate their findings about the impact of the policy on hospital revenue and services. On the right side, you can see a figure that was done as part of this research team's policy environment scan, and the roles and decision-making authority that different local health and policy stakeholders in the health system, which helped to inform the research team's engagement and dissemination strategies. Thank you for watching this presentation on Making an Impact: Pathways to Policy Change for Researchers. We hope that this material and some of the strategies we identified are helpful as you think about your own research and how it can impact policy. Additional resources that you might find helpful are provided in the next 4 slides and can be downloaded and reviewed after watching this presentation. There is also a companion guide to this presentation, so be sure to check that out, as well as the other learning modules that Laser Pulse offers. We look forward to hearing about how your research is impacting policy.